Good morning, everyone. Thank you for joining us. We're going to get started here in just a moment and give everyone a chance to log in. Thank you, everyone, for joining us today. We're going to go ahead and get started, and I'll hand it over to ASH Executive Director, Laurent Hubert.
Thank you, Nichelle. So welcome, everyone, to this webinar co-hosted by ASH, the African American Tobacco Control Leadership Council, the American Medical Association, and the National Medical Association, where you will hear the views from the plaintiffs and partners involved in the lawsuit against the FDA regarding the proposed FDA rule to prohibit menthol as a characterizing flavor in cigarettes. Today, you will hear background information on menthol tobacco in the United States, data supporting the menthol ban, an historical perspective on the lawsuit against the FDA, including the citizens' petition that led to much of this work. And you also hear the views from the plaintiffs around the proposed rule and where do we go from here? What are the next steps? Before I introduce the speakers, some quick Q&A, some quick housekeeping issues. First, if you have questions, you can address them to any of the panelists and use the Q&A tool, which is the box which is at the bottom of the screen to direct the questions to a given speaker. So without any further ado, I'll introduce the first speaker, who's Dr. Phillip Gardiner, co-chair of the African American Tobacco Control Leadership Council. Dr. Phil Gardiner, please go ahead.
Look, thank you, Laurent. Let me just first start by saying and applauding the FDA for this historic decision. It is a long time coming, and I mean a long time. It should have been done in 2009 when all the other flavors, characterizing flavors in cigarettes, were suspended in 2009. It should have been done in 2013 when a citizen petition augmenting the data that we already knew that menthol made it more easier for the poison to go down. And it wasn't until we filed suit along with our co-plaintiffs when the AATCLC filed suit 2 years ago in 2020 that the FDA finally acted on this. So yes, while this is a historic decision, it is decades in the making. I should also give a shout out to the many people who worked on this, my co-conspirators, Dr. Valerie Yerger and my co-chair, Carol Magruder, and all the other members of the African American Tobacco Control Leadership Council that have worked tirelessly on the menthol issue. Let's just be clear, this is just the beginning of the end. This isn't the end. Just because the FDA say they're gonna do it doesn't mean today, if you walk out into the street, menthol cigarettes and flavored little cigars are still on the market. It'll be years in the making to get these things off the market. The tobacco industry will try and drag this out as long as it can. Indeed, it will take years. And even the idea in the final rule that says that even when a final rule is proclamated, they have another year to sell these products, we should also try and change that. While there's a very strong case made for getting flavors out of characterizing flavor of menthol out of cigarettes and out of cigars, I'd have to say there's a lot of loopholes that are still to be dealt with in the proposed rules. Getting menthol should include all products. There should not be exemptions for electronic cigarettes, for low nicotine products, or for IQOS products. We need to get menthol out altogether. And to take it even a step further, it's not just a question of a characterizing flavor. Menthol needs to be gotten rid of as an ingredient. I'm calling on all tobacco control activists and human rights folks to get to get materials into the FDA by June 6th so they can be heard on June 13th and June 15th. Let's not miss this time. Let's not miss this date. Remember, this is just the beginning of the end. The bottom line is that menthol cigarettes and flavored little cigars have been and are the main vectors of death and disease, and to the Black community, they have been historically and remain such today. The African American Tobacco Control Leadership Council thinks that the way to save Black lives is to get these products off the market and keep them off the market. With that, Laurent, I'm going to send it back to you and let my other co-plaintiffs take it over from here.
Thank you, Dr. Phil. I'll pass it right over to Chris Leung, who was the partner at Pollock Cohen, which has been AATCLC, which has been the law firm representing us in this case. Chris, please go ahead.
Thank you, Laurent. When we first decided to try and address the health disparities that existed with respect to menthol in cigarettes, we talked with many public health advocates, and they each identified this as an area where we could do the best amount of work to sort of help the most amount of people. And so in working together initially with Action on Smoking and Health and African American Tobacco Control Leadership Council, we were incredibly happy and honored to be able to work with such great organizations in sort of bringing this lawsuit. Obviously, at the time when we brought our lawsuit in 2020, FDA had been sort of dealing with this issue from time to time in a stop and start sort of process. But at the time in 2019, when we took a look at the FDA's unified agenda, there was nothing with respect to menthol and cigarettes, no planned action that we could see. And so, working together initially with ASH and African American Tobacco Control Leadership Council, we brought this lawsuit. We identified the health disparities and the incredibly long amount of time in which the agency had basically non-acted on this particular issue. We litigated the process through motions to dismiss and several conferences with the court, and we were happily surprised to obtain what it is that FDA should have been doing a long time ago, which is that they would respond to the citizen petition back in 2013, initially filed by Public Health Law Center and a group of health advocates, including African American Tobacco Control Leadership Council, Tobacco Free Kids, American Heart Association, American Lung Association, and others. And we were able to achieve through this process, through this litigation, what it is that we set out to do, which is essentially we got FDA to respond to the citizen petition. We got FDA to issue a proposed rule here through this notice of proposed rulemaking, which we expect to see formally published tomorrow. And as a result, we are exploring our potential options with respect to potentially dismissing our claims and otherwise working with the agency and supporting its efforts to bring this rule into fruition. I'll send it back to you, Laura.
Thank you so much, Chris. And it provides an amazing example of how we're using litigation to advance public health and human rights. As Dr. Gardiner said, what's really a human rights issue in this context.
If I may, and I would just also want to shout out to our additional co-plaintiffs, of course, the National Medical Association, who's been instrumental in helping us throughout this process and the litigation, as well as the American Medical Association as well, who's been an incredibly strong supporter and voice in this area, in which we have enjoyed entirely our time working together with them all. So thank you again.
Thank you, Chris, for reminding us that a lot of people, a lot of organizations were behind this success. Our next speaker is Dr. Mark Mitchell, co-chair for the Commission on Environmental Health for the National Medical Association. Dr. Mitchell, the floor is yours.
Thank you, Laurent, and I certainly want to thank all of the plaintiffs, especially the African American Tobacco Control Leadership Council, as well as ASH, your organization, Laurent, and Chris Leung with Pollock Cohen, and the American Medical Association. So the National Medical Association is the oldest and largest group of African American physicians. We've are there because we're concerned about the health of our patients, which tend to be people of color and low-income people. As you know, smoking is higher in the African American community and in communities of color, and the health effects are much greater in our communities. Tobacco is the leading preventable cause of death, and 85% of African Americans who smoke smoke menthol cigarettes. So that's why this is a major victory. This is why we are so thrilled with this first step. We realize that that this is a proposal now. We still need to keep up the pressure, but this is a major advance forward. So we know that menthol is added as a characterizing agent, a flavor. We know that menthol makes it easier for people to start smoking, particularly children and teenagers. We know that menthol makes it more difficult to quit smoking. So we are, again, very thrilled that we're going to be able to hopefully reduce the number of smokers through this action and increase the health and life expectancy of all people, but all smokers, but particularly those of African descent. So with that, I want to again thank all of the plaintiffs, and we know that there are a lot of organizations that have been involved with that, and encourage you to keep it up. ASH was involved in the 1980s when I first started. We worked closely with ASH, and glad that they're continuing, and the other organizations also need to continue. So thank you.
Thank you, Dr. Mitchell. And so we just go straight to our next speaker, Dr. Geoff Fong, professor at the University of Waterloo, who will present some of the evidence around the implementation of of menthol bans in Canada and other jurisdictions. Geoff, it's the floor is yours.
Thank you very much, Laurel. And let me just start this off here. As always, let me just see, where am I? There we go. Here we go. I just wanted to say that in the US now, moving toward a menthol ban, it's important to provide some indication of what to expect. And I represent the International Tobacco Control Policy Evaluation Project, and we have done an evaluation of the Canadian menthol cigarette ban, which took place between 2015 and 2017. The ITC project is a project of 31 countries that has, since 2002, evaluated tobacco control policies all over the world. Now, from 2015 to 2017, all of the Canadian provinces banned menthol cigarettes. You can see them there, starting with Nova Scotia in May of 2015, concluding with the national ban, which picked up the last three provinces, British Columbia, Saskatchewan, and Manitoba, in October of 2017. So there have been two evaluation studies of what happened when Canada banned menthol cigarettes. The one study that was done by our ITC Canada project, and there was another one that was conducted by the Ontario Menthol Ban Survey. And what we did was we pooled together these data because both studies had the same basic design, very similar measures, and the timing of both the pre-measure before the ban and the post-measure after the ban was nearly identical. So we pulled the data together to get the definitive analysis of what happened when menthol was banned in Canada. And so the provinces included in this analysis were between 2016 and 2018. You can see the ITC survey and the Ontario survey overlap considerably. And same thing with after the ban. the two so that we pulled the data together. There were 7 provinces that were included in this analysis, 83% of the Canadian population. We looked, our primary measure was the quit rate. Did the menthol ban increase quitting among menthol smokers? So 22.3% of menthol smokers after the ban indicated that they were no longer smoking. So we had a control group of non-menthol smokers, and this is a wonderful control group because they're intermingled within the Canadian population, but the menthol smokers are affected by the ban, the non-menthol smokers are not. So it's a natural experiment. So the 22.3% of menthol smokers, that was a significantly higher quit rate than the control group, the non-menthol smokers. So that difference of 7.3%, which was highly statistically significant, is an indication of the impact of the menthol ban on increasing quitting among menthol smokers. Menthol smokers were significantly more likely to quit in Canada after menthol was banned. So what we then did was we did a projection of what would happen when the US bans menthol cigarettes. And we obtained the number of menthol smokers in the United States from the 2019 National Survey on Drug Use and Health. You can see there that it's 18.3 million menthol smokers in 2019, among which 5.2 million were Black American adult smokers. And as of course we know, there's a much greater proportion of Black American smokers that smoke menthols, over 80% compared to non-Black smokers. So they're disproportionately adversely affected by menthol cigarettes. So then what we did was we took that 7.3% of the effect size of the Canadian menthol ban, and we multiplied it by the number of menthol smokers. That gives us the projected number of US smokers who would quit after the US ban. And that you can see there that the projections are that if, when the US bans menthol cigarettes, there would be an additional over 1.3 million smokers would quit, among whom 381,000 would be Black American smokers. So in summary, when Canada banned menthol cigarettes, menthol smokers were significantly more likely to have quit. Menthol bans increased quitting. If applied to the US, which has a much greater share, menthol has a much greater share of the cigarette market than it did in Canada, this would lead to, our predictions are, an additional 1.3 million smokers would quit, among whom over 381,000 would be Black American smokers. We also have other analyses that I'm not presenting here. We didn't find any additional purchasing from illicit sources in Canada after the ban. And the impact will be even greater than the 1.3 million smokers because the US ban also includes cigars. So that's what I wanted to convey to you, the fact that we are expecting that this is going to have an extraordinary impact on increasing quitting among menthol smokers in the United States based on our data from Canada. Thank you. Back to you, Laurent.
Thank you, Geoff, for this very useful background on the data and supporting really this evidence supporting the menthol ban. Our next speaker is Joelle Lester, who's the director of the Commercial Tobacco Control Program at the Public Health Law Center. And she will present the citizens' petitions and some other information, which were very much at the genesis of also of this ruling and of this from the FDA. Joelle, the floor is yours.
Thank you, Laurent. And it's wonderful to be here today with these wonderful leaders in public health and health equity. As many of you know, the FDA has had the authority and the evidence to prohibit menthol in cigarettes since 2009. And it has been an honor and a privilege to work alongside the leaders of this movement for the last decade to try to push the FDA to translate their authority and evidence into protective public health policy. We're not all the way there yet, but this announcement and proposed rule is a huge step So I want to acknowledge the African American Tobacco Control Leadership Council and the Center for Black Health and Equity in particular for pushing this issue forward for years before we filed the citizen petition in 2013, and help transform the policy landscape at the state and local level when the FDA didn't act. We are thrilled, though, that the FDA has finally granted our citizen petition calling for the prohibition of menthol cigarettes, and delighted that they went one step further with prohibiting all flavors in all cigars in this proposed rule. This is probably the single most important action the FDA could take today to reduce health disparities and advance equity. And it is long overdue and thrilling to be at this point in the process. So I do want to also just congratulate the plaintiffs, all four of you, for your leadership and the bold action of suing the FDA, which is an uncomfortable place for public health advocates to be in. And it was the necessary push to get the agency to finally act and to start saving lives. So really, my hat is off to all four organizations, and definitely to Chris Leung from Pollock Cohen for his tireless work on behalf of the plaintiffs. There are next steps, of course. So while we savor this moment and this victory, there's a lot for us to do. And Dr. Phil referred to this. So we have a responsibility to engage in the public comment process, which, as was mentioned, opens tomorrow. And we're here for you. The team at the Public Health Law Center is quickly preparing resources to help you understand what's in the proposed rule, what the potential loopholes are that Dr. Phil referred to. So in other words, how the FDA could adjust the proposed rule to make it even stronger. And then once the final rule is in place, there will still be more to do. The industry always sues the FDA over any great regulation that the FDA comes out with. And so there will be more process there. And then there's also more the FDA can do. The FDA has more authority it can deploy to advance health and health equity. And so our work here isn't done, but this is definitely a great moment. I'm going to put a bunch of resources in the chat developed by my colleagues at the Public Health Law Center. So you can see, if you're interested in a little light reading, the original citizen petition, the supplement we filed in 2021, a timeline of FDA activity and inactivity on menthol. And then we have some resource pages, including we have a webinar tomorrow that will explain the rule and help you understand how to participate in the commenting process, how to make sure you're good evaluation data of your local policies and your experiences mobilizing the affected communities in your area can be brought to bear to inform and improve and strengthen the FDA's final regulation of menthol. And then I also want to make sure we don't forget that the state and local action must continue. The FDA has a critical role to protect health. But they have never been the leaders in tobacco control. It's always been that locals lead the way, and that will continue to be true. The locals have already led the way on menthol policy change, and we can't rest in that work until we get all the way to the final rule being enforced and in place. And then we have more work to do until we get to the end of the tobacco epidemic. So keep carrying on with the good work you're doing at the local level, and try to make sure to engage with the FDA so they do their part as well. And that's it for me. Back to you, Laurent.
Thank you. And indeed, it sounds like there's quite a lot of work still left to do, and we'll have more time during the Q&A section to address that. The last speaker before we go into the Q&A section is Kelsey Romeo-Stuppy, who's the managing attorney at Action on Smoking and Health. And Dr. Gardiner mentioned the human rights element of it, so she'll address how we can use the Convention Against Racial Discrimination is one of the very few UN human rights treaties the US has ratified, and some interesting opportunities that we have to use that to actually accelerate the work around the menthol ruling. Kelsey, the floor is yours.
And thanks everyone for being here with us today. I wanted to piggyback a little bit off of what Joelle was just saying, mentioning how important it is to keep going at the local level, and also talk about sort of that's bottom up from the US, local to national. And I also want to talk about top down. So we want to keep our international pressure on the FDA as well. As many of you might know, right before we heard back from the FDA last year saying that a rule was coming, we at ASH and our partners at the African American Tobacco Control Leadership Council and the DC Tobacco Free Coalition led a report to the Convention on the Elimination of Racial Discrimination. I know there's a lot of words and acronyms here, so give me a second and I'll explain. But our report to CERD, which stands for the Committee on the Elimination of Racial Discrimination, asked them to keep an eye on what was happening in the United States around menthol and specifically around targeting to African Americans. The Committee on the Elimination of Racial Discrimination is a UN treaty body, and their mandate is around, obviously, racial discrimination. So we thought this would be perfect for them and very interesting to their subject matter. The United States, as I'm sure many of you are aware, does not frequently sign treaties, and this is one we are party to. So now that we have an FDA rule, or the beginnings of one, I should say, we are still going to keep the pressure on because we have a really unique opportunity. The United States is coming up for review in front of this committee. That happens approximately every 5 years. The cycle is about every 5 years, although it's a little inconsistent. And our review for the United States happens to be in August. So the timing for this is perfect. Our first report will need to be tweaked a little bit because we now know what the rule will look like. And we encourage the committee to keep pressure on the US. And we're hoping that from a human rights perspective, that can be a really powerful tool, particularly for local advocates. And that's a little complicated to explain right now. We are going to have a webinar doing a training to how to explain CERD to be used in local advocacy. But one thing I did want to say about it is if the Committee on the Elimination of Racial Discrimination were to come out and say that menthol advertising is a human rights violation, that language victory is just huge. And local advocates being able to say that the tobacco industry and the US government are violating the human rights of their populations and of African Americans in the United States. I think that's a humongous advocacy tool and can be very, very impactful. So that was a very quick run through of that. We're going to be working on the report. We had 100 organizations sign up the first time. Because we're changing it, we have to reopen these sign-ons. So everyone who signed on before will have to sign on again. And the report will be submitted to the committee in mid-July. So that's pretty quick turnaround on this. But we will be hosting a webinar in early June. The date hasn't been set yet. But the goal of that webinar is to explain the CERD process, how it works, and how you can get involved from a local advocacy perspective. If you are on ASH's webinar list, we'll make sure you get the email. If you aren't on that list, please sign up and we'll get you that information. I also wanted to talk about another webinar we're hosting, again, piggybacking off of what Joelle said, with the comments coming up for this rule. I'm sure a lot of you are feeling a little overwhelmed by the comment process and what exactly to say. ASH is going to host a webinar that we're hoping to bring in experts from other countries who have already done the menthol ban, and they can talk us through some of the loopholes and some of the issues they've faced and hopefully help guide your comment process. We are hoping to host that in the next couple of weeks. Again, everything's moving so quickly, so I don't have a date for you. But if you can please sign up for our webinar list, we'll make sure you get that information as well. So I think that was all for me, and back to you, Laurent. Thank you.
Thank you. And so you hear more about those various processes, and definitely in the context of the using the Convention Against Racial Discrimination, because it's legally binding to the countries that ratify a treaty. It basically becomes law in the United States. So to some extent, we have to maximize on using those global international mechanisms, and other fields really use them. And sometimes in tobacco control in the United States, it's not quite as used as much. Now, so we have plenty of time for Q&A. Again, I'll remind everyone to use the Q&A tool at the bottom of the box. the little icon at the bottom of the screen, and you can feel free to address them to a specific panelist. And I see there's quite a few questions on. So it was mentioned that tomorrow there will be the process is opening for comments, and so it's wonderful that we have obviously this ruling. But how do we? What are how do you advise the listeners to engage in this next phase? Because it's wonderful that we have this ruling, but obviously the industry will do everything it can to influence it in a negative way. So how do we how do listeners engage in that process?
I'll hop in with a suggestion. So the docket for public comments will open tomorrow, and then the minimum length of time for that particular docket, given this kind of rule, is 60 days. So anyone can submit a comment through regulations.gov, and we have resources on how to do that. And we can also provide individual support to you as you're developing your comment and getting it into the record. You can contact any of us at the Public Health Law Center, but you might start with Desmond Jensen, who's the lead of our FDA work. In almost every docket for public comment that the FDA has had since it's regulated tobacco products, the industry has requested an extension, and I would absolutely expect that to be the case in this as well, since putting off a restriction on menthol cigarettes has been a goal of the industry throughout since the beginning of time. And then they will also participate in the docket robustly, you can expect. And you've probably seen in the news, they are amplifying their false arguments about criminalization of the African-American community and illicit trade. And it's going to be really important for all of us to engage in the docket to make sure the FDA has all of the best information rebutting the industry's arguments. So I would guess that the timeline for public comments will be extended at least 30 days. I don't think the FDA will accommodate a significant extension, given that they have been studying this issue since they've had authority over tobacco products. And this will actually be the fourth public docket on menthol cigarettes. There was a public docket associated with our citizen petition in 2013. The FDA issued an advance notice of proposed rulemaking in 2013. And again in 2018, that gathered thousands of comments from the public. So the FDA has a lot of information already, and I hope that they move quickly to start reviewing those comments and get a final rule out the door. And then it was also noted that in the proposed rule, the FDA proposes to start enforcing this regulation 1 year after it's published, and that is in statute, but they can deviate from that and enforce it sooner if there's a compelling reason to do so. And I certainly think that attracting and addicting new generations of tobacco users is a compelling reason to shorten that timeline. So we hope the FDA will consider doing that, and you might consider commenting on that as well. When we looked at, and Chris and Leung and I were talking about this, the timeline to implement the original rule prohibiting all other flavors in cigarettes was 3 months. So certainly a year is more time than necessary, and we're anxious for the rule to start saving lives.
I have a quick question on what's the best outcome we can expect out of the comment period and the potentially worst outcome? One of the challenges, and Dr. Gardiner mentioned it right at the beginning, is the term using characterizing flavors versus banning all menthol. So what do you think could happen? What's the best outcome we can expect within the 1 month period, if that's extended a month for the comment period, or the worst outcomes?
I mean, what's been let me just piggyback on what Joelle has said. What has happened in the past is not only have they've gotten an extension, let's assume they do get the extension, and there's more comments put in. People should keep in mind then once the comment period is over, the rule has to go upstairs to the Office on Management and Budget, which has the ability to edit without oversight anything that comes up there. As we know, in 2016, when FDA deemed all other tobacco products under its purview and actually said that menthol and all flavored products should be removed from the market, and went upstairs to the OMB, and the OMB redlined, I think it was a 16-page appendices that supported doing that. So people should be prepared. I hate to say this, Laurent, that was the worst outcome. There could be changes that are significant that come out of this. That leads me to the second point of what Joelle said about people need to make comments now, ranging all the way from removing menthol from all products, not just some, and removing menthol as an ingredient, not just a characterizing flavor. Moreover, as it's been ratcheted up in the last few days, and actually we have data, people need to make comment. The FDA says it in their actual ruling that they've put out, that what they're talking about applies to manufacturers, wholesalers, retailers, and distributors. It has nothing to do with individual possession. They say it directly. In fact, if you look around the country at all the laws around menthol that have been passed, not one person has been arrested for possession of a menthol cigarette. So the conflating of police violence, which something needs to be done about in the Black community, with a public health measure that we're talking about here, that was, as Geoff just pointed out, would save hundreds of thousands of lives. We have to be able to make that point. I want to encourage as many people to take that up as possible. And I know Chris has been sitting there waiting very quietly to say something. I want to shut up and Chris, please go ahead.
No, I think you encapsulated the issues, perfectly. I think they're really fantastic. And then, Joelle and Kelsey did a fantastic job just sort of encapsulating just sort of what we can expect and what the next steps are. I would encourage anyone that's interested in providing comments to do so and to coordinate with the Public Health Law Center or any of the other plaintiff organizations here. I think that to the extent that there is a delay in the final implementation of a rule, I think my understanding is that there will just be delayed benefits. All the benefits that are otherwise identified by the agency with respect to saving lives from nicotine addiction or death will all be delayed. And so while the proposed implementation time period of a year has been proposed by the agency, it's not ideal. Obviously, the sooner the better would be what it is that we would all prefer. But the FDA at least has left it open for comment. And so if you have an opinion on that, you can certainly share that with the agency and should do so.
Thank you. So clearly the message is very strong. Send the comments. And also a very strong message is that this phasing out of menthol products has nothing to do with possession and use. It's all about the selling and the marketing of the products by corporations. I see that Jeffrey Fong has up there. But a few other questions I want to get to with Geoff. I see you want to respond to that, those initial questions also. Geoff, go ahead.
Yeah, I mean, I just wanted to say that we've been waiting decades for this in the US. The Black American community has been suffering disproportionately from the scourge of menthol cigarettes. And they have the most to gain proportionately by a menthol ban. And so that's the way to sort of think about what we're dealing with historically and then moving forward. This is a rule that must continue to proceed expeditiously. Lives are at stake, and especially Black American lives.
Absolutely. I'll go to from one of the questions from the attendees. So if the lawsuit, and this is a question that probably Chris Leung or maybe Joelle will want to answer. So if the lawsuit is dismissed without any prejudice, can the tobacco industry use that to delay the rules on implementation? Is that a concern you have from a legal perspective?
The question seems to be about two different issues. And so with respect to voluntarily dismissing our case or claims, remaining claims, that would be without prejudice. And so we would be able to revive our lawsuit or restart up our claims with additional facts to the extent that we felt that it was necessary to. But what we would like to do here is give the agency at least an opportunity to do the right thing. We think that it has the political will, we hope, to sort of follow through on this first step. With respect to the tobacco industry using stall tactics to delay the rule implementation, that sort of presupposes that the agency actually issues a final rule, which we are all hopeful for. Certainly, once the agency issues a rule, then there will be many, many interests looking at that particular rule, including the tobacco industry. And I think it's fair to say that all parties involved, FDA, ourselves, the industry, would expect some sort of lawsuit given the amount of money at stake for the tobacco industry.
Anyone else wants to add to this? No?
Let me just add one thing. I think Statis's question is on the money, and as Chris knows, we just talked about this yesterday. And I'll piggyback on what Geoff has put forward. This has been going on so long, there needs to be a remedy provided for African Americans, and that remedy should be cessation services that are culturally appropriate and language specific, that actually begin to address the harm and danger that has been done to our community, whether that comes from a legal case, whether that comes from the federal government, whether that comes from state and local agencies identifying this as the way forward. Those remedies have to go forward. We can't just get rid of menthol cigarettes, throw it off the cigarettes, and essentially throw African Americans another way, a different way under the bus. So let's keep that in mind as we move forward. I know we've had some discussions amongst the plaintiffs about how to address this issue. Is this something the FDA can do? Or is it a recommendation they can do? Is it something that we need to do separately? It's something that can also be made in the comment period about the need for this taking place for greater cessation services. So I just wanted to make sure we got that in there before we got off.
This is a wonderful point, by the way, and one that I think is very important and links to what Kelsey was mentioning earlier, given that we have this very unique opportunity where the US is being reviewed by an international human rights body. And so in whatever report US American civil society present to that committee, to make sure that that's addressed in it, because it would be very important that that committee, which is made of international experts, then recommends to the United States to address that topic, which you just mentioned about culturally sensitive cessation services. Joelle, were you going to add something?
Well, I really appreciated everyone's comments on that particular topic. And I guess I just wanted to add that the tobacco industry's subversion of the very legitimate concerns about violence against the Black community, police violence against the Black community, is especially galling, given that racism does underlie this whole industry, and the decision to exempt menthol from the flavor restriction in the Tobacco Control Act in 2009. So I think that the industry is now trying to say, this is a punitive measure against the Black community, but really what we're trying to do is target the Black community with the health protections it has been denied and the health supports it deserves, and not allow the tobacco industry to continue its pernicious and predatory targeting of this particular community. And I would add, the LGBTQ community has also been disproportionately harmed and left out of public health protections related to menthol cigarettes. So I think that racism is absolutely a part of this conversation, but the tobacco industry's effort to deploy it to sort of obfuscate their own terrible actions is so upsetting. But I think we have to be able to talk about this and how in the public health community, this is, Del Monte Jefferson calls the exemption of menthol in the Tobacco Control Act the original sin. And we have to come back and correct that. And then we have to do more, like Dr. Phil is saying, by making sure we're bringing resources to bear in support of a community that has been intentionally left out of the public health protections that were extended to others in 2009.
So Dr. Mitchell, I saw you nod your head. Do you have anything you wanted to add to that point that Joelle just was making?
Yes, I mean, we know that the industry has been targeting African Americans since the 1970s. I remember when they first started doing that, and it has been effective. First they started targeting Kool cigarettes, and so then more African Americans smoked Kool. Then they later targeted Newport, and more African Americans started smoking Newport. So it's not like that there's a dissidents. And the health effects are very dire. I didn't mean to make light of them. It's not only death, it's also disability. You know, if you smoke, you're more likely to have amputations, you're more likely to, and diabetes and a number of other, heart disease, lung disease, all of that. So the sooner we can get people to stop smoking, the more benefit will come to everyone, but particularly African Americans. And so that's what we, the National Medical Association, our goal is to reduce health disparities. And this is a major step in doing that.
Thank you for your support in this lawsuit. Kelsey, I saw you raised your hand a few minutes ago. Is there anything you would like to add or related to?
I just wanted to add that our comment to the Committee on the Elimination of Racial Discrimination will be broader than menthol. We're here today to talk about menthol, so I focused on that, but we will absolutely be discussing health inequities in the United States around tobacco, particularly lack of culturally competent cessation support. And we encourage input from other groups here on any other things you think are relevant to add. I also wanted to mention that the committee will obviously be dealing with some of the issues we're talking about, including police brutality. So we need to make our issue important in front of the UN Human Rights Treaty body, but also recognize where we stand in the importance of the lineup there as well. The United States obviously has a lot of issues we need to contend with. So we want menthol to be front and center, but also we recognize that there are other issues as well.
Yes, of course. I just want to go on questions then in terms of comparing it also to what's happening in other jurisdictions, including Canada and other places around the world, which have already done that and already phased out menthol or tobacco products and done in different ways. So I was wondering, Geoff, for example, so there's one question about whether the 1 year implementation timeline is appropriate, or is that inadequate if you compare it to what was done in Canada, the EU, Brazil, Ethiopia, some of the other countries that have done that. So that's one question. And then also related to the Canadian experience, if you compare to, for example, the African-American population in Canada versus the United States, some of the support also that was given was some support given also in terms of cessation. What are some of the lessons learned that could be applied or used or in the countries of the comment process, that sort of stuff that could be helpful to the United States?
Yeah, just very briefly, I think, first of all, with respect to a time after the final rule to implementation, I don't think there's any, quite frankly, I don't think there's a need for any more time than maybe 2 or 3 months. I mean, to clear stock off of shelves. I mean, a year makes no sense with respect to retailers. They don't keep their cigarettes on shelves for any more than 2 or 3 months. So I would push for, as soon as possible. There's no reason for delay. And, the longer you delay, the less time there is, the more time there is for smoking, the less time to start the process of rectifying the harms due to menthols. Number 2 is that with respect to what happened in Canada, I do not know of any province that stepped up their cessation services in response to the menthol ban. So really, that's anything that you can do to facilitate the impact of the menthol ban on increased services for cessation, I think would only increase the effect size above and beyond what we saw in Canada. So I'm not sure I answered all the questions. I'm happy to answer more.
So basically, the 1 year is too long. And as Dr. Gardiner said, it's already been so long, even to get where we are. So really,
absolutely. Yeah, there's no practical reason for it. And whenever we talk about implementation, we're talking about the logistics of doing it. We're not talking about the principle, because that's already been settled by the finalization of the rule. So now it's all about how you get it done. And the practicality of it is that you just need to clear stock. So a year makes no sense whatsoever.
And one advantage I think that Canada had over the United States also is there is a strict advertising ban in Canada of tobacco products. Same with the EU. There's obviously the loopholes the industry may use, but compared to the United States, there's no advertising of tobacco, of menthol products, which might be another challenge for the United States. Then I see another question in terms of bullet points of the to include in the public comments. So I was wondering, just like if I in a few minutes, if I could get one of you to maybe volunteer to just like mention some of the highlights, the key points. So, for example, that there's no exceptions. There's a few very good things in the FDA proposed ruling. Not everyone has had a chance to read it. Could I get one of you to maybe give a few of the highlights and some of the few challenges that you see in the proposed ruling, if you were to summarize it in a few words?
I'm happy to, unless someone else would like to jump in there.
Oh.
All right. So the rule prohibits menthol as a characterizing flavor in cigarettes, no exemption for low nicotine. So that's a good rule. Menthol cigarettes are the worst product on the market that cause the most disease and death and generational addiction. And so it's a good rule. It could be stronger in a few different ways. One of which is they seem open to exemptions for very low nicotine cigarettes. And so I think they are inviting comment on why they should not do that. And so go ahead and put your good comments in about that. They also could extend this restriction to all tobacco products, as Dr. Phil said in the opening. That would be very helpful and important. We know a lot more about the appeal and harms of e-cigarettes now than we did in 2009 or 2013. And so that would be a way to strengthen the rule. And then characterizing flavor is a problem for a couple of reasons. One is menthol is an additive in almost all cigarettes. It has cooling properties that facilitate the use of the harsh tobacco products. It's why it's often used for initiation. And we know that even though you can't necessarily perceive menthol in all of the products, that it is acting to facilitate tobacco product use. So getting rid of menthol as an additive would be stronger. Without that, there is no definition of characterizing flavor, which is actually a problem for the flavor prohibition for all cigarettes, because they don't say what they mean by characterizing flavor, which means those additives are still in there, making it easier to start smoking. So a better definition of characterizing flavor would be helpful for many reasons, including for enforcement of state and local policies. The FDA in this proposed rule did get a little more specific about what the criteria could be for identifying a characterizing flavor, and I commend them for including that. That is a step in the right direction. It could be stronger, and I hope that folks will comment on that piece as well.
Thank you, Joelle. And so you brought one of the big challenges. Geoff, I'll let you go first, and Kelsey, I see your hands are up. So Geoff first, and then Kelsey.
Thanks. I just wanted to extend what Joelle was saying about characterizing flavors. This is a concept that is both deceptive and hard to characterize itself. What does it actually mean? And the assumption in the EU is that they have tasting panels there, or sensory panels, that are supposed to look at or have some exposure to a tobacco product and try to say whether menthol is in it. But I think that's really horrible because, as Joelle said, menthol is in almost all cigarettes, whether or not you can sense them. And to use characterizing flavor as an equivalency for a public health standard is bizarre because it assumes that your sensing the flavor there is equivalent to its actual impact. And we know that it has cooling effects, whether or not you can detect the flavor of menthol. So it's just a wrong concept for understanding the impact of these additives. We should do a contents ban on it. Now, whether or not the legal sort of structure exists in the US or in other jurisdictions for that. Don't know. But that's scientifically and for public health, that's where we should be moving toward an additive.
That's what Canada has done.
Yes.
As opposed to Europe.
Yeah, no, it's actually confusing. Yes, for the most part, it has. There's some complexities that are I don't want to get into, but there are total bans in some provinces, and actually at the national level. Anyway, it's complicated, but yes, there is some.
The gold standard is really going banning menthol as an additive to any cigarette or any tobacco product.
Yes, we should be heading toward a total ban.
I saw that Kelsey and Dr. Gardiner had their hands up. So Kelsey, you go first, and then Dr. Gardiner after.
I just wanted to briefly respond to the question about the bulleted list. I know Public Health Law Center is putting together resources on how to put together a complaint. And Ash is, I mentioned this earlier, but going to host a webinar to answer a lot of your questions around, I saw a question about the EU products directive and some of these questions about Canada, to use sort of a lessons learned globally on how to write your rule. So I think, unfortunately, the answer for right now is hold tight, and the resources are coming as soon as we can.
And more information from Europe. And we have some of our guests even today, Dr. Vardavas and others are here who can give us more from the European experience and how we can use it than the United States. Dr. Gardiner, please go ahead.
I just wanted to go back on the issue of menthol as a characterizing flavor. And I think a lot of this has to do with digging into that the industry knew about this in the first place. There used to be each year an annual meeting of tobacco held by the tobacco industry to go over different topics scientifically. In 1993, that meeting was on menthol. And we actually learned from that meeting that all cigarettes, pipe tobacco, chewing tobacco, have menthol in it. They're not at the ability to characterize or you can taste it, but they all have, Marlboro has menthol in it, even though you can't taste the menthol. And the reason they put it in there is that menthol, by definition, is an anesthetic that masks the harsh taste of tobacco. It has a numbing effect, and it leads to deeper inhalation. The deeper inhalation leads to taking in more toxins, leads to greater addiction, and makes it harder to quit. They put it in all tobacco products. So from a public health point of view and a human rights point of view, getting rid of it as a characterizing flavor is just step one in a process of getting rid of it altogether. I can't emphasize that more. And I just wanted to make the point. It was also mentioned, I see my colleague, Dr. Valerie Yerger, put in the question that the shelf life of menthol is questionable given the question of mold growing in them. And it leads me to my last point that we need to look very closely at the tobacco industry documents that can be accessed at the University of California, San Francisco. The tobacco industry knows half of the things we're talking about here, half of the things I would say, we know half of the things that they're talking about. I want to encourage people to look into this in as much detail as they can. Thank you, Laurent.
Thank you, Phil. So you really bring up a very important point that basically the United States, to live up to its obligations under international human rights treaties, has ratified particularly the UN Convention Against Racial Discriminations. It really must ban menthol cigarettes, a point that the US needs to be reminded of. I have the very last question before we close. It's around who will have the authority for enforcement of the rule, and how will that work in terms of the once it's then fully implemented?
The FDA has authority for enforcement. The FDA, because this is a restriction on manufacturing and distribution, the FDA already regulates the manufacturers, and there are all kinds of rules that those manufacturers have to comply with. The FDA has a robust enforcement operation in place. They also have contracts with the states for retail enforcement of federal laws, but this would be largely conducted by the the FDA themselves, given that it's primarily a restriction on manufacture.
Great. So before we close, I'd like to give the 6 panelists an opportunity to say the last words to the audience. And I'll start in opposite order of the speakers. So I'll start with Kelsey first, followed by you, Joelle, then Dr. Fong, then Dr. Mitchell, then Chris, Leung, and Dr. Gardiner, to give just the last few words to the audience. So Kelsey, you go first.
Just thank you all for coming and being here. Please make sure to get your comments in. And congratulations to everyone. This is a huge victory, but also keep up the good work because we still have a ways to go.
Joelle?
I'm just so thankful to be part of this amazing group of leaders for health equity. And I think that this is such a victory to get to this point, but this is also a real opportunity. And there's so much injustice in the world. There's so many hard problems to solve, but we are so fortunate because we have a solution that will advance health equity that we have worked so hard to get to, and we're almost there. So this is not a moment for rest. This is a moment for further engagement and activism until we see it across the finish line.
Thank you for that reminder, Joelle. Dr. Fong, Geoff, please go ahead.
Yes, I think this is a wonderful, extraordinary combination of science, policy, human rights law, and concerns about equity. It's all coming together within this proposed rule. And the Canadian experience has shown very strongly that it will work and it will save hundreds of thousands of lives. And I hope that this concludes expeditiously so we can get on with a true menthol ban.
Thank you, Geoff. Dr. Mitchell, please go ahead.
Yes, again, I want to thank the partners who have been part of this and those who are listening. The National Medical Association, since its inception in 1895, has been looking to reduce the health disparities and to address health issues. And again, cigarette smoking leads to a number of different types of health issues and to premature death. And so this is a major step forward. And so on behalf of our physicians and our patients and the African-American community, want to thank you and encourage all of us to continue to push forward for better health.
Thank you, Dr. Mitchell. Chris Leung, please go ahead.
Thank you. I just wanted to say it's been an incredible honor and privilege to work together with these fantastic plaintiffs and the Public Health Law Center. They've been incredible partners, and it's been enjoyable every step of the way. I'm glad that we were able to get the agency to this point in time, this public health milestone. And as each of the advocates here and all the other advocates out there have already noted, this is just the first step. We would like to get to the point of a final rule and support the agency in making that become a reality.
And Dr. Gardiner, last but not least, you have the last word.
I just want to thank everybody that joined us today. I want to particularly thank the other panelists here. I do want to just a word of caution. In 1965, Amílcar Cabral, one of the leaders of the fight against Portuguese colonialism in Cape Verde and Guinea-Bissau, was questioned about, well, things are moving forward, and aren't you happy about it, similar to where we are today? And while he agreed, and I want to really shout out and agree with what we've been doing here, and I really do. I do want to say we have to keep up the work at the local level. We have to keep up the work at the state level. We have to refute the industry talking points, regardless of whose mouths they come out of. And as Cabral said clearly, and I say this to all my colleagues, claim no easy victories, tell no lies.
Thank you. Thank you for the last words. I want to thank everyone for joining us today. We will have another webinar on the topic also, and there's also stay tuned for the webinar from the Public Health Law Center, given that this is so critical and important for this next stage. ASH will also organize a webinar on May 11th on the topic of environmental issues and tobacco control. So that will be on May 11th. We'll focus on product waste and lessons from around the world and very specific campaigns that are taking place on using environmental law to advance tobacco control. And in many countries, actually, environmental law is a very useful tool to advance tobacco control. So that could be quite interesting also to a lot of you, and also encourage a lot of you to go into our human rights hub, given that it's a tool that we're starting to use more and more to advance tobacco control. So again, congratulations to everyone involved in this wonderful outcome with the FDA ruling. And now, as has been mentioned by all the speakers, it's not the time to sleep on our laurels. A lot of work remains ahead in order to make sure that no more delays in really banning menthol and protecting the health of all Americans from the tobacco industry. Thank you very much, and stay tuned for other webinars and continue. And again, thank you for being champions in public health.